Okay, so for beautiful lady here, we're going to do the 11 and the forehead. Give me big mad face. She tells me is that she always says what the, and that's what's causing these. So we're gonna inject the muscles. We'll do 16 units here. Recommended is 20, but I think the corrugator, and then you can see this is the procerus 4, and then this is the tail, the procerus, and then we'll go to the other side, the what we call the head, and then here little bit we'll follow it, the tail, and then we'll give her a break. Okay, so that she doesn't say it again as well to me now. Okay, so now we'll move to the forehead. Let's see, the forehead I always like to evaluate honestly more than any other area. The other areas I can always emulate how the muscles are. Like for example, I don't have to ask the patient, but if I do this I can see the muscles. The forehead, lift your eyebrows up. Okay, so she has most of the lines actually in the middle and high, so that's perfect because she doesn't have much here where there's no injection zone, because that's the area where you inject it, it pushes the eyebrows down. So that's a good distribution she has for the lines and wrinkles, because we don't have to get any close to that area. Okay, we'll give her a break. It's a little superficial, probably a little sensitive. And all this little bit of blood on the skin, that's not gonna bruise. It's gonna stop in a few seconds and then it'll not gonna do anything. It's just all what we call skin a bleed that will stop immediately after. The skin bruise if you inject in the actually a puncture or a blood vessel, a vein or an artery, and so far we're good. I don't see any of that. And then I can see, like when I go to the side, I'm high so that we don't create any pressure on the eyebrows. And that's it for today's Botox for this area.